Hi, my name is Carla. I'm going to be your nurse for today. I'm just going to start off by providing us some privacy and do some hand hygiene. Can I start off by verifying your name and date of birth?
Cadence 1040903.
Alright, perfect. So I do have some orders from your provider to perform a head-to-toe assessment. I'm just going to check all the systems of your body, just make sure everything's functioning properly. Is that okay with you?
Yes.
Alright, this is going to involve me touching you. Is that okay?
Yes.
Alright, so I'm going to start off with some questions. I already asked your name. Can you tell me who the president is?
Biden.
Tell me where we are right now.
The doctor.
And why are we here?
I'm having a cough going on.
Okay, and just from how you've been answering to me, you're answering me clearly, your speech isn't slurred, you're making eye contact with me, you're able to move your neck towards me and look at me. And have you had any head injury or anything, been in a coma?
Mm-hmm.
Alright, so for the Glasgow scale, it would not apply to you, but it's basically for those that have had head injuries or were in a coma, like checking their cognitive skills and everything like that. Alrighty, so I'm going to start by checking your skin. So what I see is your skin is evenly, there's no lesions, there's no bumps or anything abnormal. Already looking at you, you don't have any abnormal physical deformities. And I see your skin is warm bilaterally, you have an even skin tone for your ethnicity. Alright. And so I'm going to start off by checking your head, okay? I'm just going to check your head region, your eyes and everything. Have you had a headache at
No.
all? Alright, I don't see any lesions or anything, no lumps. Your hair is evenly distributed. Do you have any drainage in your ears? Are you hard of hearing? No? Okay, I'm going to check them real quick. Alright, and now just tell me whenever you hear the snapping, okay? Just tell me when.
Mm-hmm.
Okay, so you did good on the hearing test. Next one I'm going to do is I'm just going to look at your eyes. I see your eyes are symmetrical. They are lined up with your ears. I don't see any drainage in your eyes. There's no redness. Doesn't look like any irritation. Do you have any problem seeing?
Mm-mm.
Do you wear any contacts or glasses?
Mm-mm.
Alright, so next one I'm going to do is I'm just going to assess your eyes. By looking at your eyes with the light, I see that your pupils are round and I see that they're equal. Alright, and I'm going to see how they do. So I'm going to have you look at this pen and I'm going to have you look at the corner of the room. And I see that they're both accommodative. So they're equal, round, reactive, they respond to light, and they're accommodative. And I see that your pupils, when I look at them, they're 3 millimeters, okay? Okay, so now I'm going to look at your nose. I see that your nose is midline to your face. It looks good. Can I just have you tilt your head back? Okay, so your nose is, I see that it is moist and it is pink. Do you have any trouble breathing?
No.
Okay, I'm just going to have you plug one side of your nostrils and breathe for me. I'm going to have you repeat the same thing on the other side. Do you have any problems?
No.
Okay, so that's good. And now I'm going to look into your mouth. Is that okay? I'll just have you tilt your head back. Okay, so your oral mucosa, everything looks good. Your teeth look good. Your gums, everything. Do you have any problems chewing? Any problems swallowing? Okay, I'm going to have you lift your head up a little bit. I'm going to just do a swallow test, okay? Okay, so you passed the swallow test. Your trachea is also midline, so that looks good. Alright, so next what I'm going to do is I am going to start off by checking respiratory, okay? So what I already see is that your respiratory rate is 16 and it's deep and unlabored. So I'm going to just go ahead and check your lungs. Is that okay? Okay. So each time you feel the stethoscope, I'm going to have you take a deep breath, okay?
Mm-hmm.
And it would be underneath the clothing. So I'm going to have your right upper, and then your left upper, and then your left upper still, and then your right middle, and then you lift your arms up, and this will be your right lower, and then your left lower. Alright, so I'm going to do the same thing on your back. I'm going to have you lean forward for me, please. So I'm going to do your right upper, your left upper, your left lower, and your right lower. Okay, so everything sounds good. And real quick, what I missed on your skin assessment, I had to check for any clubbing. So can I have you do this with your fingers real quick? Okay, so no clubbing. I'm just going to check your skin trigger. I'm going to see the elasticity, see for any dehydration. All right, so everything looks good there. Your lungs sounded good. Can I just, have you had a cough or anything lately? No? Okay. If you were to have a cough, I would have you, I'm going to educate you on these techniques.
I meant to say yes. I'm sorry.
No, you're good. I would educate you on these techniques. I would have you turn to your side and take a deep breath and cough, and it's going to help expel the mucus. So this would be your incentive spirometer. This is going to help expand your lungs. It's going to make sure you don't get any infections, no pneumonia or anything. So what you do with the incentive spirometer is you breathe in and then you exhale out. It's going to help expand your lungs as you breathe in and then you expand it all out. Alright, so that's going to be it for the respiratory assessment. And now I'm going to go ahead and go into your cardiac assessment. Is that okay? Mm-hmm. Alright, so next what I'm going to do is first I'm going to check your fingers. I want to check for your capillary refill. This also goes with the skin assessment too. I can check it here. I see that your capillary refills are less than 2. Next I'm going to do is I'm going to check your lower and upper extremities bilaterally for any pitting or edema. Everything looks good. Can I see your arms? Alright, awesome. Everything looks good. Next what I'm going to do is I'm going to go ahead and auscultate your pulses, okay? So I'm going to check your radial pulse bilaterally, your dorsal pedis pulses bilaterally, and your posterior tibial pulses bilaterally. Alright, so those were all +2 regular, good pulses. Alright, so next I'm going to check your heart sounds. Okay, so what I'm going to do is I'm going to check where your mid-clavicular line is. It's going to be in, we're at your aortic, and at your pulmonic. I'm at your Erb's point, and then your tricuspid, and then your mitral valve. And then also at your mitral valve, I can count your apical pulse for a full minute. Okay, so I got your apical pulse, and I got that for a full minute whenever I was at your mitral valve. And your S1 and S2 sounds were both present. If I wanted to check for S3 and S4, I would use the bell of the stethoscope. Alright, so next what I'm going to do is I'm going to I'm going to do the musculoskeletal assessment on you. So I'm going to have you flex this leg. Alright, and now extend. Do you have any joint pain or anything? Okay, so now we're going to do that again, but I'm going to add some resistance, okay? Alright, so flex. Okay, and then extend. Alright, and now we're going to go down to your foot. I'm going to have you do the dorsal flexion position. And then the dorsal, and then the plantar flexion position. Okay, now we're going to do that again with some resistance. Okay, and I would perform this bilaterally. Now I'm going to go up to your arms, and I'm going to have you flex normally, and then extend. Okay, I'm going to have you flex with some resistance, and then extend with some resistance. Okay, and now I'm going to do your wrist, and I'm going to have you hyperextend, extend, and then flex, and I'm going to add some resistance, and then hyperextend. Okay, so I do all of that bilaterally and everything looks good, okay? Alright, so next what I'm going to do is I'm going to test your gait. So I'm just going to have you walk from here to the end of the bed and see how that goes. Okay, and then when you walk back, I'm going to have you walk heel to toe, but just look up, okay? Alright, and before you sit back down, I'm going to perform the Romberg test. So I'm going to have you have your arms to your side, and then close your eyes, and then I'm just going to test your swing, see if you have any swing. Alright, and your balance is good. You can lay back down. Okay, now I'm going to palpate and auscultate your abdomen. Okay, so do you have any tenderness, any pain?
Mm-mm.
When was your last bowel movement?
Yesterday?
Okay. Do you have any difficulty?
No.
Okay. Alright, so I'm going to, well, first I would have you lift your shirt up, which I'm not going to do here. So you check for any lesions, any whatever. Anything out of the ordinary. I'm going to make sure your belly button is midline, make sure it's not, nothing out of the ordinary, like unhealed scars or anything. Alright, so no distension. I see that you are flat, everything is good. So now I'm going to listen to your quadrant. So I'm going to start at your right lower quadrant, your right upper quadrant, your left upper quadrant, your left lower quadrant. If I didn't hear anything, I would keep it at each quadrant for 5 minutes until I heard something, or if I don't hear anything, then it is what it is. So everything sounded good. So now I'm going to palpate. Alright, so since there was no tenderness, so I'm going to go at your right lower quadrant, your right upper quadrant, your left upper quadrant, and then your right lower quadrant. Your left lower quadrant. Okay, so everything was good. Let's see. Do you have any questions? No? Alright, well, I'll document these findings and have your provider come in, okay?
Right, thank you.
You're welcome, thank you.